Toe walking is a common pediatric condition in which children walk on their toes or the ball of their feet. Hello, this is Tamara. I'm a pediatric physiotherapist. I'm going to share with you some information about toe walking and then to show you some therapeutic exercises that can be done with toe walkers. When toddlers start walking around the age of 12 and 18 months, they begin walking by placing their whole feet on the floor. Then their growth and development accelerate, and by the age of 2 and 3 years, we expect from children to walk using heel-to-toe pattern. However, some children begin walking on their toes as soon as they start walking. This is normal, but if children continue to walk on their toes for a period more than 6 months, then I advise you to consult an experienced pediatric physiotherapist. Toe walking can happen due to many reasons. One of them is a neurological condition such as cerebral palsy, or a musculoskeletal condition such as shortening in the Achilles tendon, or a developmental disorder like the autism spectrum disorder, or it may be due to unknown reason, as we call it idiopathic toe walking. Why do we need to care about toe walking? Well, we'll all agree that toe walking is an abnormal walking pattern and has adverse physical consequences such as muscle shortening, muscle weakness, and frequent falls. Besides, if it's due to a known medical condition, then symptoms of developmental delay are commonly observed. A thorough assessment by an appropriate team of healthcare professionals is a must to determine the correct intervention pathway. Generally, the first line of intervention is physiotherapy and orthotics management. Physiotherapy should focus on preventing and treating complications of toe walking, such as muscle tightness, muscle weakness, poor balance, leg pain, and other related issues. I'm going to show you several helpful exercises that can be done with toe walkers. I have categorized all the exercises into 4 main categories: stretching, strengthening, balance, and motor planning. Let's start. Motor planning is a skill that we all need to learn any new skill, such as walking, running, or even a more complex skill, such as driving. It's an advantage to teach children the normal walking pattern as early as possible, because the more children walk on their toes, the harder it is to break this habit. So, practice, practice, practice as early as you can and as frequent as you can and in different environments to teach children the normal walking pattern. If toe walking persists after physiotherapy and orthotics management, then other intervention may be considered, such as a surgery to release tendon tightness. If your child walks on his or her toes, then I do recommend to consult an experienced pediatric physiotherapist to assess your child and then to determine the correct intervention pathway. I hope you found this video helpful. Please don't forget to share it with whoever may find it helpful. Subscribe and hit the notification button so you don't miss any future videos. Thank you for watching. See you in the next video. Salam.